Hello, everyone. So welcome back to my channel. And today we're going to talk about all the people or all the professionals that do all the testing. Now, we can have all the doctors, chiropractors, dentists, nurses, nurse practitioners, physiotherapists, and so on. And those who do diagnoses or make recommendations on what you should do or not do, they need some of these test results so that they can determine what is the best course of action. And so we're going to talk about all those people who do this, and there are all regulated health professionals, as they are in board certified or licensed. So different countries and different states or provinces may use different terms. Here in Ontario, we call them registered, or they are registered with a college and they're licensed. But like I said, in other countries or provinces or states, they may be called something else. But they are educated, they have a college, and they're regulated. And usually, which I haven't mentioned before, a lot of these professionals, they also have international organizations. And so a lot of people may belong to those national organizations as well. So today we're going to talk about who are these people, what kind of tests do they do, where do they do it? And actually, they're really, really very key and really crucial, because if they do it right, we get a good result. But if something goes wrong, then we may not get the right information. So for example, when I used to work in ICU, I used to take blood from my patients and I used to send it down to the lab. They would process that. Well, they are lab techs, and now they're also biochemists there and microbiologists, but also the people that actually work the machines and figure out what does this mean. Then I get results back. Well, it's really important that I did it properly, meaning how I took the blood, because we can take it in many different ways, but also that they processed it properly so that whatever number I get back, and I may have to adjust things for the clients, patients, that it is the right number. So we all work together as a team, right? But they are down in the lab and they're doing their work. So we're going to talk about where do they work, what other professionals there are. And I lumped together a number of them so that we don't do each one separate, because then it would be just a lot of videos. So this is really kind of good at who does the tests. So let me share my screen with you so that we can take a look at this. And then we can talk about who are those who do these tests. So all those tests, because we do a lot of tests in healthcare. So the first one is who does them. So there are medical laboratory technologists. There are also medical radiological technicians and sonographers, or those sonography is also ultrasound, and nuclear medical technologists. They all go to college and university and also continue to specialize by taking extra courses. And they are all regulated healthcare professionals, and they're regulated by the RHPA, or the Regulated Health Professions Act, just like nurses, doctors, midwives, psychotherapists, massage therapists, and so on. Now, what do they do? So they do take blood in some areas, some places, and other samples. So they may take urine samples, they may take sputum, or you take it into the lab. They do x-rays, all types of x-rays, ultrasounds. They do different types of nuclear scans. They do test to heart, like an ECG, and they process the tests also in the lab. Now, the medical laboratory technologists, they can work in hospitals in different departments, such as outpatient lab, inpatient services, and also blood bank, and the actual lab tests where they check samples, where the tests are being done. So they may be in microbiology, or they may be in laboratory, or they may be in the blood bank. And blood bank is a whole separate area from, let's say, the lab. Medical radiology technologists and sonographers, nuclear medical technologists, they may do certain types of diagnostic tests. Now, I used to take patients who are very sick to medical diagnostics, and they do a lot of different types of work. So they can do in nuclear medicine, they can do nuclear scans, like, for example, find out if there's an infection somewhere that they can't find in any other ways. They inject someone with a dye. Nuclear technologists, they know exactly how to handle that material. It's very special, and also how to do the scan and how to inject properly. They also work in the X-ray department. CT scans all are done by technologists. And they may have some nurses also working there to inject dyes, but the technologists, they learn specifically how to do CT scans. Same with MRIs, that's another specialty. Ultrasound, and also they work in interventional radiology, where they may put in lines They may do special tests where they have to put in catheters in the major arteries or veins. So these are all very special, but they are all under these categories. And now you know who does all the tests and works hard to get those answers. So in this very small section, I just wanted to kind of explain that, remember, when you go to do these tests, they may not be able to give you an answer. They will take the test. They may tell you why they're doing the test. They may see things, like say an ultrasound tech may see something, but they may not necessarily tell you what the result is, because they usually have to send it into the physician or a radiologist to read the actual test, and then it's sent to the physician to interpret, or someone will look at it, another specialist, to see what the test means. Sometimes it's just simply, what is your hemoglobin, or what is your white count, or how are you clotting? Those are simple ones, but they're more complicated tests that you need a specialist to interpret. What does that mean? And these are the professionals that actually do these tests. And I think it's really important to follow all the instructions that they give you to a T, and that you do exactly as they request, because if the sample is not properly obtained, if it's not well done, then it can interfere with the results. So nurses do it in certain things, but I don't do any ultrasounds. I don't do x-rays. I call people and they come up and they do their magic. But what I do is, if they tell me prep a patient a certain way, then I follow their instructions to make sure that we get the right test, we get the right results, so we can take better care of you. And that's it, very short and sweet, but do be nice to them, because they're lovely people and they help us figure out what is happening with the patient. And this happens in outpatient as well as in the hospitals. So that's it for now. I'm signing off. And next time, I think I'm going to do some dental and oral surgery kind of stuff. And then we'll post that as well. And we're back. I'm back at it, or we are back at it, because there'll be some other people joining us on these videos. And have a beautiful week. Take care. Bye-bye.